And we're back. Wake Up Nigeria continues with health. Our health discussion is one that I know will resonate with quite a few people for many different reasons. Have you ever had lower back pain before? Yep, that ache that affects you when you want to stand up or sit down or maybe take a long walk. Yeah, that's the pain we're going to be talking about today. We have Dr. Olatubi Olawale here, an alumnus of the College of Medicine, University of Lagos, a physiotherapist with a specialty in sports and orthopedics and rehabilitation. Lower back pain, wow, goodness me. It does feel like everyone at some point sort of experiences some kind of tension in that area.
Yes.
What are the major causes of lower back pain?
The first, lower back pain usually is the pain around your lower spine. Okay. And we have the upper spine, that's from your neck. We have the middle spine, then the lower back. Why? Because the lower back is the one responsible for every lifting.
Okay.
The weight bearing, all the weight of your upper body goes to your lower body, your lower joints. And it's the most movable part of your spine. That is why it's actually very susceptible to having injuries. A lot of people have experienced or will experience low back pain in your lifetime. So it's not necessarily because you are old or people will think because I'm not 60, why am I having low back pain? It can happen to anybody at any age. Causes now, there are 1,001 things that can cause low back pain.
Okay, you said 1,001.
That means
because I used to think of lower back pain as something that, happen maybe if you have poor posture, or maybe you have an office chair that is not so good for your back.
That's one of the causes.
Okay.
Another cause is, again, probably some people when they want to lift heavy objects.
Okay.
And the hair snap. That snap, that's the beginning of their back pain, low back pain.
Wow.
Or some people probably they are living sedentary lifestyle. You've been sitting for too long, sleeping for too long. You are susceptible to having low back pain.
Okay.
Or probably you are, office people, if you've been working for 8 to 5, what is 8 to 5 hours, working for too long, sitting in one position for like 8 to 7 hours, not doing anything, you are susceptible to having low back pain.
Okay.
And low back pain has caused at least is the leading cause of disability in the world presently.
Wow.
Yes.
Interesting.
And it can be acute and it can be chronic. Chronic sense that if you're having low back pain and the low back pain has been more than 6 weeks, then you think, okay, you're having low back pain.
Okay.
Or when the low back pain is even affecting when you want to use the toilet, you want to ease yourself, you want to pass feces, and you're feeling that, okay, you're having difficulty, then that is a very good red flag. It's a red flag for low back pain also. Okay. Okay. And also, if you're having sensations like having loss of sensations and power on your lower limbs, on your legs, that means that lower back pain is actually a very serious one that doesn't need you to go and sit down and just go to the hospital and for further examination. Okay.
So now, your back is not something you can see. It's behind you. It's like you can feel it, but not anyone around you probably be able to notice it. So some people have, formed the habit of self-medicating, for instance. They feel any kind of stress. Maybe their job is a stressful one. Maybe they carry heavy things daily. They carry bags for people. They carry very heavy loads on sites. They've been self-medicating for so long, What are the likely things that are to happen if people like that don't seek treatment?
Now, there's no problem when you self-medicate yourself for low back pain, when you self-manage yourself for low back pain.
Okay.
Because one thing, September 8th was World Physiotherapy Day, and we were talking about low back pain. The theme of this World Physiotherapy was low back pain. Now, if you want to self-manage yourself, the essence of everything is exercise. Okay. Exercise has been proven to be one of the most effective treatments for low back pain.
Wow, okay.
Exercise, so any kind of exercise you do, regardless of any kind of exercise. Why is it exercise? Because when you're exercising, you are strengthening your muscles of your back, you are strengthening everything so that when you even want to carry something heavy, the back muscles is strong enough to withstand that stress. So exercise has been proven to be one of the most effective form of management of low back pain. Okay. Then people are so fond of taking strong analgesic, strong pain relief. The truth about it is that if you take anything strong analgesic, after 3 to 4 hours, the pain will still come back. Wow. So if the pain is just severe, just takes a light NSAID, ibuprofen is fine. Okay. It's fine. So there is no point of you taking very strong analgesic just to make sure that your low back pain is gone. But it won't go. But exercise has been proven to be one of the most effective form of treatment of low back pain.
So, you know, there are many types of forms of exercise. Now, if you have lower back pain, you wouldn't be advising people to do weightlifting, for instance.
Yes.
Right?
Even if you want to do weightlifting, you progress it to the level at which your back can contain.
Okay.
If you're having back pain, you can't be lifting 10, 20 kg or 50 kg of weight or everything. No. So exercise, regardless of any kind of exercise you're doing, walking, bridging, back exercises, consistency is very, very important in exercise. Consistency, when you're consistent in the exercise you're doing, and exercise also must be probably be prescribed also by your physiotherapist and be managed too. Your physiotherapist will check your exercises and say, okay, fine, do this kind of exercise, this kind of exercise that is best for you, kind of exercise that you should not do, I should not do.
All right. Now, I have to say, in terms of physiotherapy, sometimes we think of, you know, the physician doing something for the patient, physically doing something, like the way chiropractors work. For instance, chiropractors and physiotherapists, I feel like they're in a similar field, right?
Yeah.
But there are some people who go for massage and things like that. Does that actually help, or does it compound the problem?
Yeah, massage, you know, if you go for massage and you are going for massage with someone that is not really experienced in that field, they might actually even cause more damage to your spine.
Okay.
Because when you're even massaging the back, there is a way you must. You don't just go deep and press and start pressing and causing more damage. There's a level at which you go for these manipulations at your back. One of the things physiotherapy do is manual therapy, manipulations. And as a physiotherapist, we know the level at which we can actually do this. And sometimes X-rays and MRI gives us a clearer picture of what is happening at the lower back. That is one of the other imaging you can do when you go for an X-ray to see if there is a
deeper problem, yeah?
Yeah, deeper problem. That's just the major thing about that.
So if you are having back pain and it's become chronic, something that continues over a period of time, and you see a doctor, maybe also follow up with those kinds of tests. X-rays, yes? You mentioned X-rays.
MRI, then see if the therapy. What would the physiotherapy do for you? Just make you manage your pain and also make you actually live a better life.
All right. Dr. Olatubi, you know, it's always a pleasure having you right here on Wake Up Nigeria. And hopefully someone at home has learned something. You probably have someone in your immediate community, in your environment who's going through this, and you have some advice to give them right now.